If we move on to another controversial one, root canals, which I know are quite controversial as well. I know Fraser Bailey, good friend who created Root Cause, the documentary.
Yep.
ADA came after, Netflix pulled it.
Yep.
He said,
Yep.
whoa, I didn't expect that, but they did it.
Yep.
They came after him hard, and everyone involved, Dr. Minkoff, a friend of mine, like so many people. What's your take on root canals? Let's go back to the start of that then.
Exactly. Let's just go back to the start of it. So clear back in the 1980s or the 1800s, dentistry were even in long before that even, but 1800s, dentistry was done by barbers and by doctors. Kind of interesting. So really the only thing that they were doing was pulling teeth. Well, that's how mercury filling started, as barbers went, this is really hard stuff. I mean, like literally pulling a tooth is really pretty hard. So I can't even imagine doing it in a barber's chair with no anesthetic. I mean, it'd be terrible.
Mm-hmm.
So that's how they started mercury fillings, is they said, gosh, it'd be nice to just like plug something in this hole rather than having to pull so many teeth. Well, the same thing happened with teeth that the cavity had gone all the way to the nerve. So the nerve is now dead inside of the tooth. He said, maybe we can just clean out that nerve place, like clean it out so it doesn't hurt anymore and fill it up. Maybe we can then keep the teeth in the head, keep the teeth so people can chew with them, smile with them. Again, for a good reason. Like nobody wants to lose a tooth. So they figured out, yeah, actually we can. We can use these teeny tiny little instruments that go down inside of the root of the tooth, clean it out really, really well, disinfect it. They use bleach. Actually, that's the disinfectant of choice is bleach. So liquid bleach inside of a tooth, disinfect it, kill the bugs, and then fill it up with the plastic-like stuff. Well, the problem with that is that isn't exactly how a tooth is made. There isn't just one main canal inside of the root. What there is inside of the root is one main canal with teeny little side channels going off of that main canal. They are too small to fill, too small to clean. So you have dead tissue out there. What's dead tissue? It's dead blood vessel tissue and it's dead nerve tissue that's living in those teeny tiny little channels that are going off of that main canal. It doesn't matter if someone did a great job doing the root canal, did a poor job doing the root canal. It doesn't matter. There's no way to get into those little tiny channels. So now that dead tissue attracts bugs. Dead tissue anywhere attracts bugs. This is why if your gallbladder is going bad, if you're having a gallbladder attack, they don't pull your gallbladder out, clean it out, stuff it full of plastic, and then shove it back in you.
Yeah.
You would never think of doing that, right? Yep. I mean,
Never.
Would you ever do that? If you have an appendicitis, would they pull the appendix out, clean it all out, fill it full of plastic, and shove it back in?
It's crazy.
No. Of course you would never do that. Why would you not do that? Well, because bacteria always are going to find dead tissue, and that's going to be dead tissue. This is why they take off a toe that's gangrenous. If you have a gangrene going on a toe, they're going to take that toe off. Why? Because that dead stuff is going to attract bacteria. It's going to attract bugs. So that's what happens, is eventually bugs will find this dead material in those little side channels in the tooth. And those bugs, first of all, they impact your immune strength because your immune system has to fight them nonstop, which wears your immune system out. It's dealing with this nonstop, which leads to a lot of other immune issues, autoimmune conditions that are happening. But it also, then the bacteria congregate at the end of the root. And every single time you chew, that bacteria gets spread through the entire circulatory system. It's just like this pump every single time. So we can't identify these very easily. You can see them if they're big on a regular dental x-ray. You can see that they're there and you go, oh, wow, this is really a biggie, and then they send you back to the root canal specialist, who then chops the end of the root off or just refiles and re-cleans it out and packs it back up again. Doesn't actually take care of the problem, because the problem are those little side channels that you can't clean. So we find them on a cone beam CT scan. This is a scan that's a special CT scan of just the head and neck area. I can turn your whole head upside down, inside out. I can cut it piece by piece by piece by piece. I can see everything that's going on at the end of that tooth. You cannot believe the abscesses we are finding. Finding quarter-size holes in people's jawbone that they had no idea was there because it doesn't hurt. Remember, we took the nerve out. The nerve out when the root canal happened. So the huge bone destruction, it's crazy. But not only that, is just the health effect. So I see so many patients on a daily basis. So many patients. I've yet to see a patient who has cancer who doesn't have an infection somewhere in their mouth. And I can say that straight up because it's true. You can look back through every single record I've ever taken. Yeah. Why? Because this kind of infection is low dose chronic and it affects your immune system's ability to defend yourself against other things. So did the root canal cause the cancer? No, I will never say that. However, the root canal affected the immune system, which then makes the body less defensible. And so
Right.
that's why we end up with chronic disease, autoimmune disease, other chronic diseases, because the body is no longer able to defend itself nearly as well when it has a chronic infection like this. This is now showing up on CT scans. So I can say this, and I don't
Yeah.
have to worry about people throwing tomatoes at me anymore, you know, because I can show you scan after scan after scan after scan of failed root canals. And there's no way to take care of it except for removing the tooth. I wish there were. If there were, I would be the first person to do it. I would
Yeah.
like to save your tooth as well. But the only way to do is we have to take out that root with all that dead tissue in it. There's no way to preserve that dead thing in your head and keep you or it healthy.
Yeah.
So that's
Yeah.
a big deal.
The idea of keeping dead organs in the body is just a very strange one altogether.
No, you would never do it. Any other organ, and people don't think of a tooth as an organ.
Oh,
They
it
think
is.
kind of like a fingernail or something. You know what I mean?
I
But it's
know.
alive. It's alive. A tooth is alive. It's a separate organ. Not every single tooth is a separate organ on a separate channel, separate circulatory channel, separate energetic channel, meaning like just the literal energy that goes to it, why you feel it. You know, why do you feel it?
Mhm.
Because it's alive. Well, that energy actually is circulating and going to other organ systems in the body as
Absolutely.
well. It's all shared.
Yeah.
So
Yeah.
it's a big
Map
deal.
that out to the organs, each one. Yeah. There's so much that you could go into.